Hello, everybody, and welcome back to BUS80, Medical Terminology and Anatomy. And today we're going to discuss Chapter 4, the Muscular System. All right. So, muscles. MY is the medical term or the medical root for muscles. Okay. So, MY, usually with the combining vowel of O. Except for the instance of something like myalgia, which is a term we'll see in a little while. Myalgia, we take the O off, or we don't use the O, because algia is pain, MY is muscle. So myalgia is muscle pain. So we don't, in that case, we don't put two vowels together. So myalgia is pain. What do muscles do? Well, they provide support for the body. They permit movement or range of motion. And muscles produce heat. Okay, three different types of muscles. One is voluntary, which means at will or controlled at will. So, we tell the body to do things like move body parts or talk with my hands. Okay, and those would be skeletal muscles. The skeletal muscles are voluntary. Okay, and they're found everywhere throughout the body. As a matter of fact, the body has about 600 different muscles, roughly 600 different muscles. The two involuntary muscle types, visceral or smooth muscle, and cardiac or striated muscle. Okay, and those are involuntary muscles. All right. Muscle cells vary in size and length. That's definitely true. They contain different structures like a cytoplasm, plasma membrane, connective tissue like the fascia. Okay, the fascia is connective tissue that helps to hold muscle fibers together. Okay, and those muscle fibers are held together with like a sheath or a container called the fascia. Okay, tendons and ligaments. We hear these terms all the time, right? The best way to try to remember them is that tendons, connective tissue that connects muscles to bone, okay? And then ligaments connect bone to bone, all right? So if you can remember that one, tendons, muscle to bone, ligaments, bone to bone, okay? I think probably one of the definitions in your textbook when it talks about tendons, fibrous connective tissue that attach muscles to bones. The tendons enable bones to move when the skeletal muscles contract. It also creates energy through the release of the adenosine triphosphate, or the ATP. Okay, when the ATP is released from cells to produce energy. All right. Let's see, scalp muscles. Scalp muscles. So we're going to talk about some of the, I think, major muscles in the body. Of those 600, we'll talk about some of the major ones in the body. So when we look at the scalp muscles, that occipital frontal group, we look at those definitions. That helps occipital frontal group. Helps to raise and lower the eyebrows, cause wrinkling in the forehead. If you're my age, you have wrinkling in the forehead in particular. So that's what that occipital frontal group does. The temporal parietal group tightens the scalp and helps to move the ears forward. And then the auricular group helps to move the ears forward, upward, back, that type of thing. I can't do it very well, but I'm trying. Okay. The facial muscles, the buccinator and the masseters, probably the two most common. Bucca or buccae is Greek, I believe, and refers to, actually it's Latin, and it refers to the cheek. Okay, so sometimes we take medications through what we call the buccal route, which would be to put like a pill or a tablet in your cheek and allow that to dissolve. So the buccinators help to move the cheek muscles. They aid in smiling and blowing or whistling. The masseters are the muscles that are involved in chewing. Another good term is mastication. The process of mastication is to chew. Okay. Key muscles in the neck and shoulders. The trapezius. That's probably a good one. The trapezius on the back of the neck, it helps to raise and lower the shoulders. So that's kind of your shrugging muscles. Okay. Pectoralis major helps to flex and move the upper arm. Okay. The thorax, the diaphragm, very important in, it's a muscle that's very important in aiding us to breathe and get oxygen in our lungs and to inspirate and expirate. Okay, for inspiration and expiration, the diaphragm. Okay. Let's see, the abdominal muscles, the external obliques, the internal oblique, the transversus abdominis. If we look at those, the external obliques are kind of on the outside of the abdomen. The internals are more toward the middle, and then the transversus abdominis are right in the center of the abdomen. Okay, so those all help our abdomen. These are the muscles that we work when we're doing crunches and trying to get those six-pack abs that I had once before. Now I have more of a pony keg going on, but when I was younger I had six-pack abs, and those are the muscle groups that we work on to tighten up those abdominals or our core. Okay, let's see, key muscles in the hands and the arms. The brachialis, the triceps brachii, these all help us to extend and flex and to abduct and adduct our lower arms. Okay. The thigh and upper leg muscles, we can get into those. The internal obturator, the external obturator, these are all muscles that allow our thighs to move or to have range of motion. So being able to open and close your legs from the hips, extending and so abducting and adducting and pulling the thigh closer to you or away from you. These are the muscles involved in that. Okay. Let's see. So some of the lower leg muscles, the quadriceps, hamstrings, the sartorius, those are all important muscles in the lower leg. So there are two groups of muscles in the lower leg. The first is the quadriceps femoris, which includes the vastus, lateralis, medialis, and intermedius, which all work to help extend the leg. And then the rectus femoris, which flexes the thigh and helps to extend the leg also. Okay, different foot muscles. I like these two terms, the intrinsic and extrinsic. They work together. The extrinsic foot muscles are located in the leg, but they pull on tendons that move the bones of the ankle and the foot. Okay, and then the intrinsic muscles are located within the foot, and they allow for things like flexion and extension, abduction, adduction. Okay. There's a couple of terms on here like dorsiflexion and plantar flexion. So very easy to kind of talk about what that is. Dorsiflexion is the ability to kind of pull the toes towards you. And then plantar flexion is to push the toes away from you. Okay, so dorsiflex, plantar flex. Different terms for diagnostic purposes. So these would be potential diagnoses for patients with skeletal disorders. Myopathy is kind of a general term, which just is muscle disease, some sort of muscle disease. That may be an initial diagnosis for a patient until we do further examination or studies on the patient. So myopathy, the patient presents with myopathy. Myalgia, muscle pain. We had that one earlier. I mentioned that earlier. Tetany, that's a good one. A hyperexcitability of nerves and muscles due to low calcium levels. Okay. Myosclerosis is muscle hardening. Sclerosis is hardening. So my, muscle, sclerosis, hardening. Myospasm, muscle spasms. And then myositis is inflammation of muscles. Different diagnostic tests that we do a fair amount of different testing. Physical tests, the Tinels, the Phalens, and compression tests, those are all common with carpal tunnel. Okay, so we do those, basically physical tests to determine if someone is having signs or symptoms of carpal tunnel. We do different blood tests, in particular the creatine kinase, or CK, as it's commonly called. That one looks for an enzyme that tells us if there's been any muscle damage, in particular muscle damage or muscle trauma from intramuscular injections, possibly from having a heart attack, so a myocardial infarction. Okay, so muscle tissue infarct of the cardiac muscle, or possible muscular dystrophy. Okay, the degenerative disease muscular dystrophy. Muscle biopsies are very common to take a tissue sample of muscle and then send that off to the laboratory for a closer examination. Other tests that we do, things like CT scans and MRIs, electromyograms to record the electrical activity that runs through muscle, in particular for the voluntary movement type issues, to see if there's any potential faults in sending signals. We may do the electromyogram. Different muscle disorders. Atrophy is muscle wasting. Things like foot drop, the inability to maintain foot flexion. That one's common enough. I've seen that before. I had a patient in particular who presented with a foot drop, didn't know they had a foot drop. So it was really the inability to keep the foot, to maneuver the foot appropriately. This patient had actually had a TIA, or a transischemic attack. They had a mini stroke, and that caused their foot drop. Things like contractures. Contractures are fairly common, which is the abnormal flexion and fixation of joints, typically caused by muscle atrophy or that wasting of muscles. And contractures could be potentially permanent. Sprains and strains. A sprain, the difference between the two, a sprain is a complete or incomplete tear of ligaments that surround a joint. And then a strain is an injury to muscle or tendon attachment. Okay, so sprains, complete or incomplete ligament tear, and strains, injury to muscle or tendon. Okay, different types of tumors, which we see growths. We see a fair amount of benign growths or non-cancerous growths. Things like leiomyomas and fibroids, which are typically found in uterine tissue. Same thing with the leiomyosarcoma, typically found in uterine tissue, oftentimes benign. Other things, rhabdomyosarcoma, malignant type of cancer, okay, can be very serious, and originates with the striated muscles, which are the cardiac muscles, right? Inflammation and infection, bursitis, which is an inflammation of the sac that has the bursa fluid. Usually these happen around tendons over bony prominences. So things like the knee or the elbow. Seen a fair amount of bursitis in the elbow. And oftentimes, one of the things we're going to talk about as one of the treatments is something called aspiration. So if that bursa sac fills up with fluid, we can stick a needle with a syringe attached to it and aspirate or take out that fluid. That's fairly common with bursitis, on top of maybe some anti-inflammatory medication. Epicondylitis, often referred to as tennis elbow, so that's just an inflammation of the tendon that attaches to the epicondyle in the lower arm, which would be on the ulna side. And you can have medial epicondylitis or lateral epicondylitis, so you could also have it on the radial side as well, so inner or outer. So very common diagnosis. Tendinitis is just inflammation of the tendon or of a tendon. Myofibrosis, an overgrowth or excessive fibrous tissue growth. Okay. Let's see different syndromes and diseases of muscle. Achilles tendon contracture or atrophy or shortening of the Achilles tendon, very common. Carpal tunnel syndrome, of course, very painful. Wrist and hand or lower arm disorder. Sometimes, it depends on how you pronounce this. Most people pronounce it Dupuytren's contracture. I believe it's actually pronounced Dupuytren. So it's French, Dupuytren's contracture. It's a flexion deformity of the fourth and fifth fingers. What that typically means is that it's a permanent kind of flexion of the fourth and fifth digits. Okay, so they contract toward the palm. Okay, fibromyalgia, very common. We see more and more of this all the time. Chronic pain. Muscle, joint, and bone pain, chronic. Muscular dystrophy, genetic, degenerative muscle disease, kind of a combination of a couple different muscle diseases. Okay, torticollis is a good one. Neck muscles become spastic and short, and somebody with torticollis, usually what happens with that is that your head will kind of tilt toward the affected side where that shortening is, but the chin will want to go toward the unaffected side. So you end up with this kind of tilted head type of issue with torticollis. Common treatments, immobilization and rest. Very common use of splints and casts. Slings, often in combination with hot or cold therapies, like ice or heating pads. Drug therapy, non-steroidal anti-inflammatories, muscle relaxers, corticosteroids, usually for less severe muscular problems. Aspiration, we talked about that with bursitis. Massage is another good one, and a good one that some insurances are now starting to pay for. Some of these, what we would maybe think of as more Eastern medicine philosophies, like massage and acupuncture for muscle relief. All right, so that pretty much does it for Chapter 4, the muscular system. I look forward to seeing you for Chapter 5, the integumentary system, or skin.